4 most frequent causes of persistent phlegm in the throat. Are you tired of that annoying feeling of constantly having something stuck in your throat? Persistent phlegm might seem like a simple issue, but the truth is that it can hide more serious causes that few people know about. While many think it's just a reflection of colds or the flu, today you'll discover the real reasons behind this annoying mucus. From infections to reflux, each cause has its own characteristics and its solutions. The good news is that there are simple ways to relieve this discomfort and even prevent it. Have you ever wondered why the phlegm never completely goes away? Could your meals be making this problem worse? Or maybe your nighttime routine is sabotaging your health without you realizing it? Keep watching and find out how to finally resolve this annoying issue in your throat. Before we get started, don't forget to subscribe to the channel and activate the notification bell so you don't miss any updates. And let us know in the comments where you're watching from. We'd love to hear from you. First cause, infections. We know that when a virus or bacteria enters our respiratory tract, our immune system activates to fight it, triggering a series of defense mechanisms such as inflammation of the mucosa lining the nose, throat, and bronchi. This inflammation leads to increased mucus production, which not only traps germs and expels them from the body, but also contains antimicrobial substances. We could say that mucus is an all-in-one in the fight against germs in our respiratory tract. In addition, coughing is another important reflex, as it helps eliminate excess mucus and keeps the airways clear, preventing more serious complications. This is very useful when we have an infection, especially when we notice an increase in mucus in the throat, nasal congestion, and coughing. In most cases, these infections are mild and resolve on their own within a few days. However, there are warning signs that indicate the infection may be more severe and require medical attention. These signs include thick, yellow or greenish phlegm, which may suggest a bacterial infection, and, more importantly, if there is a high fever, difficulty breathing, or chest pain. It is important to remember that severe respiratory infections can progress quickly, especially in high-risk groups such as the elderly and those with chronic diseases. In such cases, seeking medical attention immediately is essential to avoid complications. Second cause, gastroesophageal reflux. Gastroesophageal reflux is a condition in which stomach acid flows back up into the esophagus, the tube that connects our mouth to the stomach. The most common symptom of reflux is the sensation of heartburn or acidity in the chest, but it often also presents with persistent phlegm in the throat. This happens because stomach acid, when it rises, irritates the mucosa lining the esophagus and throat, causing inflammation and increasing mucus production as a protective mechanism. Additionally, the acid can damage the cilia, tiny hairs that line our respiratory tract, responsible for filtering the air and expelling mucus. When these cilia are damaged, they can't perform their function properly, and mucus accumulates in the throat, causing the sensation of persistent phlegm. Although reflux is traditionally associated with excess acid in the stomach, in many cases, especially in people over 50, the problem is a lack of acid. We know that as we age, acid production decreases. When this happens, the lower esophageal sphincter, the gate that closes the stomach, doesn't perceive the need for protection and stays slightly open. In this case, even if there's little acid in the stomach, when lying down, it can rise to the esophagus, throat, and mouth, irritating the mucous membranes of these areas and increasing mucus production as a defense. How to identify reflux as the cause of throat phlegm. If you notice heartburn or burning in the chest or throat, especially after meals or when lying down. If you feel food gets stuck in the throat or experience regurgitation when food or liquid from the stomach comes back to the mouth. If you have a persistent cough, especially at night, or if your voice seems hoarse or rough. If you suspect reflux, it is essential to consult a doctor to identify the cause and find the right treatment. In the meantime, some home remedies can help relieve symptoms and reduce mucus and phlegm production in the throat. Avoid foods that aggravate reflux, such as fats, citrus fruits, chocolate, coffee, and alcohol. It's also important to avoid large meals before bed, waiting at least 2 hours after dinner to lie down. If this isn't enough, raising the head of the bed by 15 centimeters can help keep acid in the stomach and away from the throat. Additionally, some natural remedies can alleviate symptoms, such as ginger, which has anti-inflammatory properties, and apple cider vinegar, which can balance stomach pH. Vinegar can be consumed diluted in water before meals. Third cause, chronic sinusitis. The third cause of persistent phlegm in the throat is chronic sinusitis. We have air-filled cavities in the bones of our face, around the nose, eyes, and forehead, called the paranasal sinuses. These sinuses are lined with a membrane that produces mucus to protect the respiratory tract by trapping particles, bacteria, and viruses. When these sinuses become inflamed, mucus production increases. If the mucus isn't drained properly, it can accumulate, causing symptoms like nasal congestion, headaches, and the annoying sensation of phlegm in the throat. This happens due to post-nasal drip, which is the excess mucus dripping from the back of the nose into the throat, causing the need to clear the throat, cough, and the constant presence of phlegm. Causes of chronic sinusitis. Infections. The most common cause of acute sinusitis, which if not properly treated, can lead to constant inflammation of the sinuses. Polyps. Small growths that develop in the lining of the nose or paranasal sinuses. Deviated septum. Can block mucus drainage, favoring the development of chronic sinusitis. How to identify chronic sinusitis? There are several symptoms that can indicate the presence of chronic sinusitis. Persistent nasal congestion that can last for weeks or even months. Pain or pressure in the face, especially around the eyes, forehead, or cheeks, which worsens when leaning forward. Bad breath, caused by mucus buildup in the sinuses, which can be a breeding ground for bacteria that produce odor. Loss of smell, which occurs when inflammation affects the nerves responsible for the sense of smell. If chronic sinusitis is caused by an infection, there may also be fever, fatigue, and general malaise. If you notice these symptoms, it is important to consult a doctor to determine the cause and appropriate treatment. Fourth cause, allergies. The body sometimes overreacts to substances that don't actually pose a threat to our health, like pollen, dust, or mites. When an allergic person comes into contact with the substance that triggers the reaction, their body releases histamine and other inflammatory substances that stimulate mucus production. If the cause isn't controlled, the mucus can become thicker and more viscous, getting stuck in the throat like a magnet. In some cases, this reaction can persist for days or weeks, causing ongoing discomfort and affecting the person's quality of life. Allergies can manifest in many ways, but some signs may indicate that the phlegm in your throat is caused by an allergy. First, seasonality. If you notice that phlegm appears during certain times of the year, such as spring or fall, coinciding with the blooming of plants or increased presence of mites, it is very likely that the allergy is the cause of the phlegm. Second, the presence of other allergic symptoms like itchy eyes, sneezing, or nasal congestion. Additionally, prolonged use of decongestants can worsen the problem, leading to the so-called rebound effect, where the body produces even more mucus. If we suspect that throat phlegm is caused by an allergy, the most important thing is to identify the allergen and take steps to avoid it as much as possible. If we're allergic to pollen, we can try keeping windows closed during the blooming season or use air purifiers at home. In the case of mites, we can reduce their presence by washing bedding in hot water and using anti-mite covers for mattresses and pillows, as well as maintaining good ventilation in rooms. Keeping an allergen-free environment can significantly help reduce the frequency and intensity of symptoms. If the allergy is severe and causes difficulty breathing or limits daily activities, it will be important to consult a doctor. In more severe cases, the doctor may recommend specific medications, such as antihistamines or immunotherapy, to help control allergic reactions more effectively. 5 natural remedies to eliminate phlegm from the throat. Now that we know the causes of phlegm and their possible solutions, we should also know that there are 5 natural remedies that can help strengthen the immune system and eliminate excess mucus. Garlic. The power of garlic for the throat comes from allicin, a compound formed when garlic is cut or crushed. This compound acts as a natural antibiotic with antibacterial and antiviral properties, strengthening the immune system and helping to fight infections. Additionally, garlic is a powerful antioxidant, aiding in the protection of cells against damage and preventing premature aging. Regular consumption of garlic can also help reduce inflammation, relieving sore throat symptoms and promoting faster recovery. Hydration. Drinking plenty of water is essential to prevent excess mucus, as water hydrates and dilutes the secretions, making them easier to expel. When we don't drink enough, the mucus becomes thicker and stickier, making it harder for the body to clear it out. Moreover, water helps the cilia, the tiny hairs lining our respiratory tract, which are responsible for moving mucus out of the body. Without enough water, the cilia don't function properly, and the mucus tends to accumulate in the throat. Thyme, an aromatic herb that relieves cough and congestion thanks to bioactive compounds such as thymol and carvacrol, which help dissolve thick mucus in the respiratory tract. You can use fresh or dried thyme to flavor dishes, or prepare an infusion with 1.5 teaspoons of thyme in 240 milliliters of boiling water, letting it steep for 10 minutes before straining and serving. Peppermint, a refreshing herb with decongestant properties. The menthol in peppermint has a mucolytic effect and creates a cooling sensation that relieves nasal congestion, opening up the airways. To prepare the infusion, use 1 teaspoon of dried leaves for each cup of hot water. Ginger. The spicy root of ginger contains gingerol, an anti-inflammatory compound that reduces swelling of the mucous membranes, making it easier to breathe and expel mucus. Additionally, studies show that ginger can inhibit mucus synthesis and relax the muscles of the respiratory tract, facilitating air passage. Humidifying the environment. Spending many hours in closed environments with air conditioning or heating can dry out the mucous membranes of the throat and nose, increasing mucus production as a protective mechanism. This dryness can cause discomfort, like a scratchy throat and a feeling of congestion, even without an infection. If you notice a dry, irritated throat or sticky mucus, it's important to increase the humidity of the environment by using humidifiers to keep the moisture level between 40% and 50%. Maintaining this level of humidity not only reduces dryness, but also helps prevent the respiratory tract from becoming vulnerable to infections and allergies. An economical alternative is to place a bowl of damp towels in the room where you rest. Additionally, opening windows to allow fresh air to circulate or placing plants in the room can contribute to a more balanced and healthy atmosphere. Another tip is to stay well hydrated, as drinking water regularly complements environmental humidification, helping to keep the mucous membranes hydrated and functioning properly. Teas and infusions. Some herbs have mucolytic and expectorant properties that can help dissolve and expel mucus. Among these herbs, ginger, eucalyptus, thyme, and peppermint stand out, as they have decongestant effects and can alleviate the feeling of a blocked throat. Additionally, the hot, moist steam from the infusions helps hydrate and soothe the mucous membranes of the throat, nose, and lungs, making it easier to eliminate mucus. Drinking these beverages regularly not only helps clear the respiratory tract, but also strengthens the immune system. Adding honey and lemon to the tea can enhance its soothing and antibacterial effect, relieving throat irritation. Another advantage is that consuming warm liquids promotes relaxation and improves overall well-being, especially during colds and allergy seasons. Persistent phlegm in the throat can be an annoying and limiting symptom that affects our daily quality of life. However, in most cases, there is an underlying cause that we can identify, and without a doubt, taking simple steps at home can help combat it. Measures such as elevating the head of the bed, avoiding heavy meals before bedtime, and maintaining proper hydration can be effective. In the case of sinusitis, nasal washes and steam inhalations are recommended, and if the cause is allergies, identifying the allergen and taking appropriate measures is essential. But above all, it's important to pay attention to warning signs, such as high fever, difficulty breathing, or chest pain, to seek medical attention when necessary. If you have anything to add, please share it with us in the comments. Don't forget to subscribe to the channel. I'm leaving 2 videos on the screen that I'm sure you'll enjoy. See you there.